Assalamualaikum doctors. In this video I am discussing a communications that is about WPWS, Wolf Parkinson White syndrome. So as usual we start it like, hello Mr. John, hello doctor, I am Dr. Emma, one of the doctor here. I guess you are suppose Jisan daddy, is it not it? Yes. So it is really my honor to sit with a kid daddy like you and just want to admire your efforts. You brought him in the right time and you saved his life. Okay doctor, thank you. With pleasure, I am here to discuss with you some tissue about Jisan's health. Would you like anyone to attend with us or shall we start? I guess we can start. Tell me first, how much do you know about Jisan's health? She is now stable, so he is now stable, and they make a test for electrical activity of that heart, and I'm waiting for the result. Unfortunately, the electrical activity test showed that he is having a condition called WPW, and I'm really sorry for that. What is that? Okay, I will explain for you everything, but to make myself clear, please follow me at this drawing. Okay, so we'll draw a picture of WPWS. How can we tell? Imagine with me, this is our heart. Normally 2 upper receiving rooms and 2 lower pumping rooms. We have also 2 rooms to the right and to the room left. Are you with me? Okay. Normally there is a spot here in the right small area. We call it the maestro of the heart. It sends order to another spot that is called co-maestro. This co-maestro, it turns, gives order into the big room to contract, to squeeze the blood and eject it outside to the heart. Normally what happens, one order from the maestro equal 1 heartbeat. Am I clear? So this is the normal pathophysiology we tell. Yes, I got it. So in WPW what happened, an order from the maestro, instead of going directly to the co-maestro, it goes into extra electrical pathway. So it gives the order to the co-maestro over and over and over. So as a result, to the co-maestro gives order to the big room to beat over and over and over. So the final result will be 1 order from the maestro equaling many beats. So I am telling easily, our heart has 4 chambers. Upper 2 are receiving, lower 2 are pumping. And there is right side 1 room and left side 1 room, this 4th chamber. There is a maestro of the heart. It sends signals to the co-maestro. And this co-maestro, it sends to the signals to the big room of the heart, where heart is squeezed, contract and relax and eject the blood. Normal pathophysiology, 1 order of the maestro equal to 1 heartbeat. But what happened in WPWS conditions? The maestro not directly going to co-maestro. It has some extra electrical pathway, lot of. And when it give one signal going to the extra electrical pathway to the co-maestro, that means 1 order means over and over it sending the co-maestro, and co-maestro over and over sending the heart to beat and squeeze the blood, contract and relaxation occur. So that means 1 order from the maestro equal more beats in WPWS syndrome. So is it serious? It can be serious if not treated. Luckily, we have discovered it, and we will have an urgent meeting with the heart doctor. He will do a jelly scan of the heart to look if there are any in the structure of heart or not. If there is anything, okay. And he may give him medications, and he may decide to remove the pathway by simple procedure. Okay. So when? As soon as possible. Okay. Do you need to screening her sister? We can do the electrical activity of her heart. It doesn't run in genes, but children of the same family here increasing the risk of having the disease. What I will do if it's happened again, okay? If this happened again, you have to call an ambulance and you have to do some procedure to decrease the heart rate, like make message or ask him to breathe when he closes the mouth and nose like this, or you can post ice water on his face. Then somebody trusted website, written leaflets and support group. It also comes another way. I am telling WPWS. That is, first as usual IRCAP, then how much you know about your child health. Then father is telling, I saw them pouring cold water in my child face. I'm so annoyed for that. Okay, I'm apologizing to do immersion of child face in front of you. I know you are annoyed to see that by your eyes. We have to tell one of our colleagues to stand with you at the time to explain for you that we did it necessary for saving his life, as you saw. Without doing this, unfortunately, we might lose him at this moment. This is a critical situation. So what is the accessory bit? It is an extra heart muscle tissue passing between the upper chambers and the lower chambers, present since birth. Fortunately, it is not a problem in structure of the heart. So what is happened, electrical impulse normally pass from the upper chambers to the lower, and the lower chamber has a rule to slow down or limit the electrical activity to a low rate, but by adding the extra pathway that will add to the heart rate and apt the heart rate. Okay, this condition, racing of heartbeat, dizziness and chest pain management. The definitive treatment is a procedure done by the heart doctor, but first of all there are saving measures as so immersion of face by cold water and sending him. Second thing is to wear bracelet. We should avoid trigger as stress, some medications and some heart supplement medication to control the heart racing is emergency situations, the adenosine and the amiodarone. Referring to the heart doctor and then the preventable medications. What doctor will do? What heart doctor will do? So I will arrange a meeting with the heart doctor to discuss with you the definitive treatment. It is about to remove the accessory pathway. We will use a tube through the blood tube called catheter. The catheter will send a type of energy called radio frequency to destroy the accessory pathway, and that procedure can cure the condition completely in majority of children. Thank you.